Hey guys, I wanted to share something very interesting with you about this is something that I've known for quite a long time. Talk to patients about it quite often. In fact, I had some pamphlets written up a number of years ago. Um, but there's a gentleman, a medical doctor named Henry Winsor. He was out of the Philadelphia area, and this is a while ago, but he wanted to determine if whether or not what chiropractors were saying was accurate, if that there was constriction or pressure or derangement or degenerative change in the spine, that could affect the nerves that are going to some end organ, like the lungs, the heart, the liver, digestive system. And so he actually went and did a pretty elaborate study on 70 or did 75 autopsies on people who had passed away. And his findings are really quite amazing. So he performed roughly, this is something that I printed out on the internet. You can do it as well. Again, it's Henry Winsor. But he performed roughly 75 autopsies, and this is what he found in relation to the spine and the nervous system and all the organs of our body. Um, he found that stomach disease, 9 cases of stomach disease, all had spinal misalignments in the mid-thoracic spine, which is an area between the shoulder blades. Okay, lung disease, 26 cases of lung disease had misalignments in the upper dorsal or upper thoracic region, which is an area slightly below the neck, right in this area. Anyone have discomfort there? I'm sure you do, because that's the most common thing that we see in our office is mid-dorsal pain or mid-scapular pain. Liver disease, 13 cases of liver disease were associated with misalignments in the lower mid-dorsal region. Again, that's just between the scapular or shoulder blade area and a little bit lower. Gallstones, 5 cases of gallstone disease were associated with related spinal misalignments. Pancreas disease, 3 cases of pancreas disease associated with related spinal misalignments. And it goes on, guys. What's the conclusion? We need to care for our spine. What these results show is a true principle in that if you have curvature, misalignment, degenerative changes in your spine because we haven't taken care of it properly over our lifetime, then those organs that are supplied by those nerves are going to be diseased. Okay, they're going to be diseased. So what we need to do is think about it from an electrical standpoint. Our body runs on electricity. Billions of electrical signals are constantly flowing from the brains to organs and glands. The 2 main components of this electrical system is our brain and our spinal cord. Okay, and we know that if our spine is severely injured, that it could be lights out, right? It could be fatal. If we severely injure our spine, it could be something that results in paralysis. Okay, so when nerve dysfunction is neglected, this can actually exist. This unhealthy spine and this degenerative spine can actually exist without pain or symptoms. Okay, so we need to have you checked out by someone that is dedicated to the wellness of the spine. Okay, and your medical doctors, that's not what they are experts at. Okay, there's great doctors out there, but they're not going to talk to you about taking care of your spine. They're more after the fact. What can we do after the fact? So we want to take care of our spine, and we need someone that is able to do that properly with the expertise and the knowledge and how to do that. So make an appointment to identify any of these issues that you might have with your spine, any of this misalignment that we are potentially having in our spine. We need to find out where that is so we can remove that stress. It's obvious. I think it's extremely easy to take care of your spine, but we have to find out what's going on, and then we have to correct that, and then we have to keep it well. If we don't keep it well, it's going to cascade back to what it was used to or those old positions, and that's just not healthy for your spine. So Make an appointment, get your spine checked. We get our spine checked every week and get adjusted every week. That's how important we think that is. Not just for you, but for your family, for your kids. Kids are falling all the time. You think they don't have misalignment and shifting in their vertebrae? I mean, they can take it because they're young, but they have misalignment and subluxation too. So we got to get them in as well. We want to take care of their spine so that when they get to be your age, they're not dealing with the things you're dealing with, and that we can keep their organs healthy. So come on in, guys. Dr. Dennis with Olson Brothers Chiropractic. Give us a call, 651-633-0155.